Golf has become a favorite leisure activity for millions of people, and its popularity is growing. It's hard to beat the thrill of a powerful tee shot, a masterful bunker save, and the opportunity to stare down a money putt and win. Unfortunately for many, the pleasure of a day on the links comes to a screeching halt when back pain attacks.
Oh man, come on, jump out of there.
Ah, TL, you turned it over.
Oh, no.
It's estimated that 80% of all golfers will experience an episode of severe back pain within their lifetimes. As many as 5% of the golfing population suffer from severe chronic back pain. This video offers hope to the millions of golfers who must cope with chronic back pain. And for those of you who don't suffer from back pain, it provides the proper technique to avoid injury on the course. During the course of this program, you'll learn how you can reduce or eliminate back pain while you golf and avoid the need for costly appliances, medication, or surgery. We'll show you how to avoid injuries that can cause back pain, and in the process, teach you techniques that will help you hit the ball farther with greater accuracy and feel less fatigue at the end of a challenging round. Welcome to Greenview Cove Golf Club in Wellington, Florida. I'm Dan Oliver, and joining me is Dr. Bruce Dahl, a board-certified orthopedic surgeon and sports medicine specialist. Dr. Dahl specializes in the treatment of back pain for people from all walks of life. Many golfers, including PGA professionals, come to Dr. Dahl for relief from their chronic back pain after all other methods have failed. Now, Dr. Dahl, it seems unusual that an orthopedic surgeon would teach potential patients how to avoid surgery. Are you afraid you're going to lose business?
Well, Dan, no, I don't think I'm going to lose any business. Golf is something that is growing in extreme popularity, and about 80% of all golfers are going to have some pretty severe low back pain. 5% of golfers are going to be disabled with their low back pain to the point where they actually need to consult a surgeon, someone like me, to have a spinal fusion. But they still need to learn ways to protect their back both before and after surgery. The good news is that these techniques will help to prevent the type of injury that might actually lead to someone having to have surgery. And it just makes sense. You know, do the simple remedies, the simple techniques first before you get involved in serious, big-time treatments.
But are non-surgical techniques as effective in the long run? And can people with back pain be certain that they're going to work?
Well, I know they work because my patients tell me that they work. They work in the short term and over the long haul. I use these techniques myself. I've had some pretty severe chronic low back pain in the past, and I've had to educate myself about the proper techniques to do things like activities of daily living. And now I've transferred all this over into sports so that I can do sports activities. The techniques that we're going to learn today are techniques that were first described and put together in Europe for people in industry who were doing hard work. And then these were transferred over to millions and millions of people today who are using them now for play and sports activities.
Now, before we go any further, are there golfers who should not practice these techniques?
Yes, and that's a very good question. It's important to understand that most back pain, be it acute or chronic back pain, is simply a symptom of the tissues in the low back hurting, and it doesn't represent a real dangerous situation, just an annoying pain. But there are some important exceptions to this. Here are a few symptoms that can accompany back pain, and if you experience them along with pain, you should immediately check with your doctor before playing golf or practicing your swing. If your back pain is severe and constant, that could be a sign that some other problem is occurring. There could be a disease process involved. If the back pain wakes you from sleep, this is definitely a red flag. As physicians, when we hear this history from a patient, that's our signal to obtain further testing and further evaluation. If the pain goes down your leg, that could be a sign that a nerve is being pinched in your back. That would make things more complex than simple back pain alone. If you have weakness or numbness in your leg or you limp, that too could be a sign that there is some nerve involvement for which further evaluation is needed. If you have lost weight suddenly or you have other joints which are hurting, you should have a physical examination before. before you start golfing and using these techniques.
Well, that sounds like good advice, Dr. Dahl, but one thing I'm curious about, why do golfers seem to be so prone to back pain?
Well, it's not just golfers, it's the whole human race. Low back pain is a naturally occurring condition in humans. And it's really because of the way we're put together down in our low backs, the way the tissues are all lined up and the way things rotate and grind together. Let me show you right here. This is Slim. It's one of our models.
Hi, Slim.
Slim has a pelvis and a couple of hips, and this is Slim's low back right here and Slim's upper back. It's right down here in the low back. These three bones and the disc that separate them, these disc or cushions, where humans have this trouble. Let me try to orient you a little bit more on where this really is in our bodies. If we could have Gretchen step in. Gretchen's our model, and basically this spine here with the pelvis and the low back and the upper back would be oriented on Gretchen about like this. You can see that the front part of the pelvis right here would be right here and here. Now, Gretchen turned 90 degrees, and you can see that we all have this curve in our upper back, and then we have this curve in our lower back. This is called our lordosis. And when you look at the spinal model has the same thing. This is our upper back, and then our lower back has this curve right here, just like Gretchen's. So that gives us a better idea of where this spine is in the human body. So you can step away, Gretchen. And Dan, what I'd like to do is demonstrate here on a model exactly what's going on in this low back here. So what I'm going to do is use a smaller model for that.
Something like this?
Well, yeah, just like that. Thank you.
Just happen to have one.
Now, on this smaller model, if we orient it the way Gretchen was when she was standing here, so this is the low back. This is the front of the spine, and this is the back of the spine. So you can see that we have 4 bones, and we have 3 cushions between those bones. Now, the bones don't do any moving, but those cushions do. It's the soft tissues between these bones that do the moving in our backs. And you can see that if you rotate, you can really grind that disc pretty badly. And that disc is made up of soft tissue, and that soft tissue has nerve endings in it itself. So when you're grinding away at it, you are tearing tissue, and you are causing inflammation, and you are causing pain.
And golfers are just the kind of people who do that kind of grinding motion.
Exactly. So what these techniques that we're going to learn are trying to show is that you can do things such as play really every activity that is involved in the golf game, from the swing to getting in and out of the cart correctly. You can do all that by keeping your spine stable and not twisting and turning each one of these little discs in there and causing pain. By keeping it stable, you keep the pain away.
And you're going to show us some techniques on how to do that.
That's exactly right. Gretchen is going to show us first the backward pelvic tilt. That's our first position that we're interested in. So go ahead and show us the pelvic tilt, the backward pelvic tilt. Now, in the backward pelvic tilt, Gretchen has tightened her abdominal muscles and her buttock muscles, and she's flattened her back. And in this position, the spine is stable. Now, when the spine is stable in this position, the disc pressures in the spine actually drop. So not only are you stabilizing your spine, but you're keeping your disc out of trouble at the same time. So now come out of the pelvic tilt. Okay, and you can see that Gretchen's shoulders and her head height, that nothing has changed. She's not going up and down like this. Go back into it. Okay, all it is it's a rotation of the pelvis. The key here is not trying to put your spine in a certain position. It's how you hold your pelvic bones in relation to your spine. So come out of that again. Now go back into it. You can see it's just a very simple roll that flattens your back. Now the second position is what we would call the forward pelvic tilt. So go ahead and show us the forward pelvic tilt. Now this is just the opposite of the backward pelvic tilt. And what Gretchen does here is she maintains this arch in her back. So she's tightening up those muscles. She's tightening up her abdominal muscles. And it's really in this position that you set up over the golf ball. So go ahead and set up for us the way you would do it out on the course. Okay, and you can see that she's maintaining this forward pelvic tilt, maintaining this arch in her back. Her knees are bent. She's in a very stable position, and her spine, the pressures in those discs are very, very low right now. Now let's go back for one moment to the backward pelvic tilt. Now it's from this position that you do activities like walking, pulling a cart, lifting things above your waist. This is the position you want to be in for everything that occurs above the waist. Now go into the forward pelvic tilt. Okay, it's this position that you use to do things down low, like we just saw Gretchen set up for the ball. This is the position that you would bend over and pick things up from. So between the two positions, it covers really every activity except for the swing itself, which really we need one more concept, and that's called the rule of the rectangle. Now the rule of the rectangle, if we're standing here, and you drew a line from shoulder to shoulder, down to the hip bone that we saw in Slim earlier, and over to this hip bone and back up, we get a nice rectangle. The whole concept here is to be able to do all of our activities, this pelvic tilt forward and backward, maintaining that rectangle. And when we turn our bodies from side to side, we need to maintain that rectangle and not bend it or twist it. So now I'd like you to set up over the ball. So now she's doing two things. She's doing that forward pelvic tilt that we just saw, and she's maintaining this rectangle. Just open up your arms, and you can see here how this rectangle is staying as a rectangle. Now, I'd like you to just swing your body through what you usually do when you stroke the ball. So you can see that movement, she's rotating her whole pelvis and her shoulders together, so everything is moving as a unit. Okay, you can stop. So with the rule of the rectangle, in combination with the pelvic tilts forward and backward, we can do everything during a golf game that we need to do all the time, keeping our spine stable and not twisting the bones, not grinding the disc, and keeping pain to the absolute minimum or preventing it altogether.
And right now, we're very happy to welcome one of Dr. Dahl's star pupils. He is Jim Lipkowitz. He is a PGA professional. And Jim, your life has literally been changed by Dr. Dahl and these techniques. Why don't you tell us about it?
Dan, this is truly an honor to be here. And this is really a tribute to Dr. Dahl and his surgical techniques that he performed on my back. First of all, my back was broken with a grade 3 slide. It's called spondylolisthesis. These things that happened to me are very, very severe. I almost was in a wheelchair. They told me that I'd never play golf again. That's heartbreaking. It's my life. It's my love. Everything evolves around golf. What am I to do? Where am I to go? A lot of questions. We sat down, talked about surgical procedures, techniques, went into surgery, came out of surgery. I thank the Lord when I came out of surgery that I'm still here. I immediately realized I was out of pain. I thought, wow, this is really great. Now, living in a body brace for 3 months, can handle that through the winter. Come spring, we talked about modifications, what I had to do, if I even could swing the club. And as the x-rays were being taken, the bone was being fused solid. Once the fusion was taken very well, then we started to work towards a swing.
But Dr. Dahl still said that you had to change your swing or you'd risk re-injuring your back again. Isn't that correct?
Yes, very much so. So we talked about having a rectangle from the shoulders through the hips and keeping that plane in the swing as much as we can through the swing. As we worked on this, I was kind of released to do a little bit, but not a whole bunch that first year, more or less exercises, rehabilitating the back muscles. The second year came to the swing.
Well, right now we'd like you to share that gift with our viewers and demonstrate some of these techniques and how they might help them.
Well, I'd sure be happy to.
Okay, Jim, why don't you show us now how the novice who may be having some back pain ought to be swinging that club.
Okay, what I'll try and demonstrate to you is over the axis, your rectangle that we were talking about, and also how it all applies and what the amateur or my clients will be doing in their swing, and what I try to work with them and get them to do which is correct or correcting what is incorrect. And the incorrect part of the swing can help, you know, cause a little bit of back stress, lower back pain. And so what we do is we work with the individual trying to turn around on an axis, keeping the rectangle in perspective without doing that. What I find, Doc, is that the average golfer, when he gets up to the swing, he'll get set up and he's all ready to hit the ball. He'll draft the club back and he'll get back in this position, but he'll also stay from the axis point, which is running through us this way. He'll want to turn way over to here. As he gets over here, now he's changed this rectangle and put a twist to it.
And that puts a lot of extra stress in your low back.
Exactly. Yeah, that is exactly true. And then when he begins his swing, he'll begin from the top and he'll start his hands coming down like this, and then he'll swing through. And now he's in this position and his hips haven't followed yet, but as he stretches further, he'll turn and follow with his hips. And this creates the reverse of what we just talked about.
So you get this twisting then as you go through your swing.
Right. Now,
how should they do it?
Okay. If you're going to keep this rectangular in a flat plane, the best that you can do, you're going to get a little bit of twisting, but you're not going to get the severe twisting by going way over to this position, pulling the head out of position, making it harder to hit the ball. What you want to do is you want to take a good shoulder turn the club 90 degrees back, and this is where the flexibility becomes, is how far you can get back to here. Some people will be more flexed. Since I've had my fusion, I'm a little less flexed. So I only can get so far back up in the top of my backswing.
Right, and if you try to twist farther, you'd be twisting your back up through here.
Yeah, then I pull my head out of position, and then I'm in the same shape of the individual pulling way out of position.
So what you're doing, you're going as far as you can comfortably go without stressing your low back.
That's right. So my swing on the backswing is a little bit shorter, but that's okay. Because I've developed a technique to add the power in the lower quadrant to bring back that shortness that I used to have a real long swing back up in here.
Okay, let's see the follow through.
Okay. After I get up to the point here, then I want to start my hips in rotation as I'm bringing the club down, so I'm starting to turn and maintaining the rectangle again.
Right, this looks like you're maintaining that right there, and you're bringing your back around as a unit.
Right, and that's exactly what we want to do. So the swing will look like...
Okay, and when you end up, you're keeping your back nice and straight. You have your heel back toward the cup, away from the cup, and your back is flat. And you've maintained a rectangle back there.
Exactly. As the training went on and working with it and working with the idea of the rectangle and coming back to that rectangle and trying to keep the back solid, I found that by getting rid of my old clubs, going to a longer shafted club, approximately anywhere from 1.5 to 2 inches. Now what happens is I can acquire this position, which is a little bit more upright. This has eliminated the forward motion of being down in this position here. When I was swing, I'd want to go like this in my swing. By adding the length to the club, now I can come up to the end of the club. When I address a shot, I'm more upright.
Okay, so you don't have to get over that.
I don't have that over bent position. I feel like I'm more in an upright position, more comfortable.
Okay.
And by being more comfortable, it makes me relax more, it makes me want to swing the club better. so I don't feel out of position to start with. As I get back to the top of the backswing, I'm in this position here. All I've got to do is rotate my hips and follow with my club, and I've maintained your rectangle that you prescribed to me.
It looks to me like you've brought the whole pelvis around as a unit,
Yes.
and you brought that around first where all the power is.
Right.
So you did not twist your low back as you made contact with the ball, and you ended up in really good position.
Now that you've seen the techniques demonstrated, it's time to practice, practice, practice. But before you head to the course, Dr. Dahl has some additional advice to help you avoid injury and keep your game pain-free, correct?
That's right, Dan. Many of the golfers that we see in our practices have injuries during their golf game that originated outside of the swing. If you don't apply these 3 techniques throughout your day at the golf course, you won't be fully protected. Take a look. Now, when it comes time to put the tee in the ground, we have to keep our back in mind too. This is a good time to hurt yourself, and you don't want to do that. We've learned the pelvic tilts, and we know that if we want to do something down there, like put this tee in the ground, we do the forward pelvic tilt. This holds our back, a little bit of arch there. The knees are flexible, and the bend occurs at the knees and the hips, keeping the back straight. And you can put that tee right in the ground without hurting your back at all. I'm feeling it all in my legs right here. So this is the ideal way to do it. Another way to do it is to bend down on one knee, but the thing you have to remember here is that once you're down on this knee, a lot of people tend to then bend at the waist when they do this. So you really want to try to keep your back as straight as you can when you put that tee in the ground. This is an alternative way, not as good as the first way. If you're not flexible at all and you have to put the tee in the ground, then you can use what we call the golf kick. The golf kick is where you actually put your leg back like this as you bend over. You can lean on your club, put your leg back, and you can see that my back is staying straight. So that's another alternative. It's important to remember that these clubs are heavy and that they can hurt your back. You need to have a plan for your back so that you can master these clubs and their weight rather than it mastering you. Now the way I do it, when I walk in the pelvic tilt. This is the backward pelvic tilt that we learned earlier. My knees are bent and my back is flat, my abdomen's tight, and my spine is stable. From this position, I can pick up these clubs and I can handle the load and I'm nice and stable. And I can walk like this. This is a good stable position. Now Jim here uses just the opposite. He uses the forward pelvic tilt. So he's tipped like this and he actually sets the clubs right on his backside. That's just fine. The important thing is you need to do it one way or the other so that your pelvis is in a stable position, so that your spine is stable and you don't hurt your back.
Let's go find your ball. I think it's in the water.
Okay. Sometimes the ball can land in the trap, but we don't want it to be a trap for our backs. So you need to do this right too. The way I do it is it's something that occurs down toward the ground, so I go into the forward pelvic tilt. You can see I'm keeping my back arched, my knees are bent, everything's stable through here. And I pull back toward myself, and I can get all this raked out without twisting or bending my back at all. And I did that without hurting anything. I kept everything nice and stable. Your day in the cart could be the hardest thing on your back. It's really important to sit correctly in this cart. When you're sitting there, make sure that you're sitting back against your seat and maintain that arch in your back. That's what keeps the pressures in the disc low. If you scoot forward like this and lean back, then the pressures in your disc are higher and you could get hurt and your back could become painful. Another thing is, sitting forward like this, sometimes you have to do it. And especially if you're going over bumps, hang on and try to take the shock with your arms and with your legs. Now getting out of the cart and back in the cart are equally important. You don't want to twist your spine as you're doing this. So slide forward, turn your whole body as a unit like this, and then get up out of the cart. Getting back in is the same way. Sit on the edge of the seat, turn your whole body as a unit, and slide back and get into a good position. If you do this, your back's going to hurt less, you'll like your cart more, and you'll enjoy your day. Let's find your ball.
Sounds good to me.
Getting the ball out of that hole is the time when you can hurt your back. That ball is deeper than the ground level, so you really have to bend over to get it. So this is one of those instances where you brace yourself over the hole. You're going down, so you do a forward pelvic tilt. You bend your knees, you bend your hips, you keep your back straight, and you go right down and you get that ball. And notice that my back really isn't bent. I really haven't disturbed this rectangle either. This is also a maneuver that you can use to deal with divots that are in the ground. If you're not quite this flexible, then it's okay to put one knee down on the ground, but here you have to put an arm down too. This arm keeps you from bending more at the waist and it unloads your back. So you can reach right in there and get that ball. Jim, can I get your bag?
Sure can.
All right, this is one of those instances where lifting can hurt your back. This bag is heavy. You want to protect your back. So with this lifting maneuver, you go into the backward pelvic tilt, you stabilize your back, and then you lift it right up. It's nice and heavy, but you can see that my back is nice and stable. I'm not hurting it at all. Turn around, and when you set it down, go down with it a little bit. Notice how I went down with the bag and sort of stayed at its level. I didn't bend over like this at the waist. All right, Jim, there you go.
Well, thank you, Doc.
Let's head for the car.
Sounds like a good idea. Great round today with you.
It was. You too. This is where a golfer can have a bad end to a good day, putting their clubs in the trunk. Jim, as a golf professional, how do you put your clubs in the trunk?
Very simply, I just lift up the bag, set it over the back side of the trunk, Undo the shoulder strap, take the top of the bag, and just drop it into the trunk.
That's excellent. You didn't twist or bend the wrong way. How do you get them out?
Same way. I just lift the front of the bag up, put it on the tailgate, put the shoulder strap on, walk away.
Excellent. It's been a good day and a good round.
Thank you very kindly.
Let's go home.
Any final thoughts, Dr. Dahl?
Don't neglect the opportunity to warm up before heading to the golf course. Stretching is extremely important since it literally gets the muscles ready to go to work. After stretching, muscles are less likely to be strained, torn, or injured by a sudden movement, and they're better able to function properly. I find it best to do my stretching exercises before I leave home to play golf. Once you're out there on the golf course, it's very difficult to stretch properly. Let's go back inside and look at a very simple but a very effective stretching routine to help get the most performance out of those muscles while minimizing the risk of injury. I'm going to have you lie down, Gretchen, and when she does, you can see that she has this normal arch in her back. Now the first stretch is to actually rotate the pelvis, and this is our pelvic tilt. Now here she's stretching these muscles back here, but she's tightening the abdominal muscles. She's holding this to keep her back flat against the floor. Now from this position, she brings one leg up, and this is her stable base. This is going to keep her stable, and her back's going to stay flat on the ground while she pulls her knee up into her chest. Now she's going to hold this for about 30 seconds. And after about 30 seconds, she's going to release. And she can do that 2 or 3 times. And then she'll do the other leg. And again, she'll hold this for about 30 seconds. And all this time, she's maintaining the pelvic tilt. And notice I can't get my hand under there. That arch is gone. So then she relaxes that leg. Now then she brings both legs up into her chest and pulls. And again, she'll hold this one for about 30 seconds. And then she'll relax. And during all that time, she's breathing in and out, nice and slow, and she's staying relaxed. Stretches should be a very relaxing thing that you do. Okay, now another thing that we need to stretch the muscles on the sides of the spine. Now, it's best to do this while you're lying down, because if you're standing up and you start to twist or bend, then you're going to increase those disc pressures and you're going to hurt the soft tissues between the bones. So while Gretchen is lying down, the spine is in a stable position and the disc pressures are very, very low. So this is the position that you want to do this stretch in. So first of all, she puts one leg over the other and she rotates her pelvis, so you can see that the shoulders are in one plane and the pelvis is in another plane, and she's stretching all these oblique muscles on the side. Okay, and she holds that again for about 30 seconds. Then we rotate back over and she'll do it in the opposite direction. And again, now she's stretching all the oblique muscles on this side. And again, she'll hold this for about 30 seconds, and she'll do each one 2 or 3 times. During this whole process, she again is remaining relaxed and breathing in and out nice and easy. Okay, now we want to do the last stretch on the floor while you're lying down, and this is to stretch the quadriceps muscles. This is a stretch that we like to do while we're lying down, because when you try to stretch this muscle standing up, you can hurt your back. So Gretchen's going to show us how to roll over as a unit, and then she's going to show us how to stretch this muscle now. And as she's pulling her foot straight back, she's staying nice and straight here, and all this is being stretched along here. And now she's going to roll over and do the opposite side. Now it's very important as she does this that this foot stays right behind this buttock and doesn't go down here like this, because that can cause problems. So she's staying nice and straight and she's getting a good stretch. And again, she'll hold this stretch for about 30 seconds and she'll do 2 to 3 repetitions of each side. So you can roll back. Now let's stand up and do the stretches from the standing position. Okay, now we're going to stretch the hamstring muscles, which are the muscles behind the thigh, and then we're going to stretch the calf muscles. So Gretchen, why don't you get into a position here where you're stretching your hamstring muscle. Okay, now you can see that Gretchen has her foot elevated on a platform. She's on her heel. She's getting a good stretch behind the thigh, and that's her hamstring. The important thing is that she's keeping her back nice and straight. She's not bent or twisted through her spine. And she's doing that by maintaining the pelvic tilt while she does that exercise. So she will do this side and she'll hold this for about 30 seconds, and then she'll go to the other side and she'll do 2 to 3 repetitions of this. Now the next exercise is for the calf muscle. Show us how you would stretch your calf muscle, Gretchen. Okay, now here she's standing up on the platform and she's stretching the calf muscle behind her left leg. Notice that the balls of the feet are higher than the heel, and this is where she's getting her stretch. Once again, she's maintaining her pelvis in a very steady, stable condition so that the bones aren't twisting or bending, and she's not hurting her back doing this. So again, she would do this leg and then do the opposite leg, hold each one about 30 seconds, and do 2 to 3 repetitions.
Today we've learned techniques that, when applied correctly, can help you play pain-free golf for the rest of your life. As with any new skill, mastery requires practice. Through your daily practice of these techniques, in work and at play, they will become more natural and form good habits. Eventually, you'll do them automatically, and it'll feel strange when you deviate from proper form. Learn these techniques, practice them, and enjoy the benefits, because not only will they help you play golf pain-free, but they may quite possibly help you play the best golf of your life. For Dr. Bruce Dahl, this is Dan Oliver saying so long and see you on the links. Thank you, sir.